Hello and Namaskar. I'm Dr. Preeti Chhabria, Director of Internal Medicine and Geriatrics here at the Sir H.N. Reliance Foundation Hospital in Mumbai. Welcome to this Facebook Live session. Today is World Elder Abuse Awareness Day. And so let us spend the next several minutes creating awareness about elder abuse. What exactly is abuse? It is an infringement on the rights of an individual in a relationship which involves trust, and as a consequence of which harm occurs. There are various types of abuse. There may be physical abuse, mental abuse, sexual abuse, which is common as hard as it appears to seem even among the elders. Financial abuse, which in these days of the use of social media, we find it increasingly common where our elders are not very familiar with the use of social media, even telemarketing. There have been several reported cases of financial harassment and financial abuse. Other forms of abuse are neglect and abandonment of the elders, and abuse which occurs in institutions which are established to actually take care of the elders. Let's understand what are the risk factors for abuse among elders. Poor physical health in the victims or in the elders makes them more susceptible to abuse. Emotional disorders and substance abuse among the perpetrators of the abuse causes them to perform these acts. Social isolation of the elders. When they have no one else to report to for help, they become more prone to acts of abuse. There's lack of support for the caregivers. So when the elders are being taken care of, but if the caregivers themselves have no respite, they tend to fall into the prey of abuse. And poorly trained staff in these caregiving facilities. Several times we notice that more and more nuclear families are being established as younger members are migrating to other areas, which leaves the elders more socially isolated and more prone to abuse. If you were to report to a study done in 2014, it's quite elder abuse is prevalent in India. In fact, one survey showed it is as high as 50% among the people who were surveyed. And what's astonishing is that 70% of this abuse came from people they were well acquainted with. Having understood this, let's spend some effort to understand ways on how we are going to try to prevent elder abuse. Firstly, we need to spread the awareness that such a condition exists. And I'm so grateful for this opportunity to spread this awareness. As a community, as a society, we need to be aware that we need to take steps to help protect our elders. If we have neighbors in our community who are elders, let's make an effort to check in on them, see how they are doing repeatedly. They may be initially hesitant to point out acts of help that they need, but if we do it on a repeated, non-confrontational basis, we are more likely to help. Abuse in elders is a reportable crime, so we should take the opportunity of any suspicion also to report it to the authorities. Other ways of prevention is to spread this education about this in the schools, in colleges, in medical educational institutions too. It should be part of the curriculum to understand that elders can be abused and we need to prevent it. A very robust caregiver support system should be established, where caregivers should not feel guilty to ask for help. I'm very proud to say that in our institution, we have set up a caregiver support group. Our social worker is playing an active role in setting up a support group which meets every month to understand ways in which they can cope better and help take care of their elders in a more robust fashion. Caregiver training in institutions also should be made more informative so that they can carry out their duties in a more effective manner. Most importantly, we need the help of NGOs, the government, and the community and society at large so that we can set up respite centers or emergency shelters where we can move the elders if there's any suspicion of abuse. Thank you for your kind patience and attention to my few minutes of talk, and I hope we'll go forward in allowing our elders who've contributed so much to the society so that they can spend their golden years in a happy and healthy way. Thank you.